Missions by
Hi everyone, welcome to a special Missions by You episode. Today I'm joined by Dr. Lauren LaRose,
Hello.
a child adolescent psychiatrist, for a special series of episodes for Maternal Health Month.
Thanks for having me.
Today we're joined by Victoria Williams. She is the Advocacy Director at the Birthmark Doula Collective, a cooperative dedicated to supporting, educating, and advocating for pregnant and parenting people and their families. Welcome to Missions by You, Victoria.
Thank you for having me.
So I want to get started with the main focus of Birthmark Doula Collective.
Yeah, our main focus at Birthmark, we have 3 areas of focus, which is direct service through doula support, lactation services, and also our advocacy lane. So those are our main focus. But we're also a reproductive justice organization. So we believe that everyone has dignity and right to birth the way they want to, how they want to, and whenever. Yeah.
That's amazing.
Yeah.
I love that. Okay, tell us what makes the Birthmark Doula Collective unique.
Ooh, what makes us unique? I would say that our cooperative model, we are one of the only doula cooperatives in the state of Louisiana, meaning that we're a collective, which really focuses on building entrepreneurship and allowing our, returning our passion work into sustainability, being that we have member ownership abilities inside the organization. But also what makes us unique is that we don't just do direct service, we're also a movement. We're a movement at our core through advocacy and programming that really expands the mission and values of reproductive justice.
Okay, got it.
Yeah.
Very cool.
How do you guys support parents beyond birth?
Well, the postpartum period is so important because of you believe that like birth happens, but then there's the aftermath. You don't know what will happen in the postpartum period. So in that space, we're able to provide direct service through postpartum care, lactation services. We have support groups where our families can attend. We also want to, extend your breastfeeding experience. So we do have breastfeeding support groups as well, postpartum support groups. So there's like, you can always tap into Birthmark at any reproductive experience because we're a full spectrum doulas.
Okay, that's amazing because I want to tap on this real quick because I have 3 kids and you can attest to this. For most mothers, I feel like after you have the baby, it's just like you're just dropped off the face of the earth with the baby, right? Which unfortunately is a first world country problem, right? Like there are other countries where that is not the case, where there's a ton of support after the mother gives birth. So that's amazing that y'all provide that services so that these mothers are not just left alone with a baby.
Yeah, it comes in our doula package, but we also have something called extended care. So like if you're like, look, I need 3 more weeks of postpartum support, and we try to figure out what that looks like for you. Like we've done we've done the gambit of whatever you need.
That's amazing.
Yeah,
that's amazing. Okay, so tell us. This is kind of a double question. All right, what is Birthmark Doula Collective's role in advocacy, and then what bills are y'all currently supporting right now?
Ooh, our roles in advocacy, we are, as I said before, we are a movement at our core. So our role is making sure that the voice of all of our families, especially those who are in underutilized, marginalized areas, but also the Black birthing experience is not just talked about, and those policies are not just made for us, but they're made by us. So we want to be able to inform those policies. So our role is to make sure that our parents' voices, our doulas, our business owners, that our voices are heard beyond the piece of paper. Yes. So we don't have any bills currently that we are leading the charge on. What we're doing now is supporting all of our community partners in whatever they're uplifting. So we have paid family leave that's on the docket this year. We have some bills about, religious rights inside of not just schools, but also in pregnancy centers, which is super, super important because you want to be able to have autonomy of your religious beliefs. Right. And when you're making choices, sometimes their religion is held, at a certain standard where they're like, well, because you're of this religion, you can't do this certain thing with your body. So we just want to make sure that our families have the right to make their own decisions. Yeah.
I think I've actually seen someone deal with this, believe one thing due to their religion, and then unfortunately was in a position where they went against their religion because they had to make the best decision for their health, their family in that moment. And I think that having that freedom is so important, that we have to preserve that, because it's very easy to judge from the outside.
Absolutely.
But until you're in that moment, you never know what when your life is on the line and you've got other kids at home, what decision you might make for yourself.
My question is, what religion will it be? Like, what religion is this space dictated by? Because there are so many. There are so many, right? And so if I walk into a space and I practice one religion and you're serving up another one, what am I supposed to do? Do I then convert? Like, what does that look like?
What does that look like? Yes.
Yeah, and I think that when we talk about bills and advocacy, the practicality of it is super important for me. So translating that information so that our public can understand the ands and the these and the ors, they mean something.
Yeah.
And so you have to be mindful and read it, but also it's my job to translate that for you so you understand it in layman's terms. Like, this what it, down and dirty, this is what it looks like.
Right.
This is how it will affect you. We've done that similarly with our doula registry board and our doula reimbursement bills. Because you're moving from community to clinical, like, we're taking doulas from a space of like, I just show up to your home, to now you have to have, a credential number, a MPI. You have to be, credentialed by all these medications. What does that look like?
Right.
That could be a huge barrier for folks. So it was our job we do town halls through the Manla group, and we're like, it's so important for us to, tell the public about what is happening beyond your state, like in your state, but beyond your daily life.
Right.
Yeah.
The good and the bad in those other states too, right? Of like what's working in other states that, maybe our state should model. Or keeping an eye out for states that are kind of going off the rails.
Which is so key for Louisiana because our session starts later. So we always get to see what Texas is doing, because we know Louisiana they love to copy Texas. So we're like, what is Texas doing? How can we get in front of these things and keep our eye out for what could possibly be a trend for Louisiana?
Yeah. Can you hop back for a second to paid family leave?
Absolutely.
Since you mentioned that.
I know. This is wild.
All right, go on your soapbox. Go ahead.
Well, I think that Louisiana LPHI is really heading this, and we worked when Governor Bell Edwards was in. He signed the paid family leave for civil workers.
Okay.
Which then was like put on hold once our new governor got into office. And so I think that it's just a ongoing push to make sure that our families have leave, can go support their families outside of, using all of their PTO or using all their sick leave. So this year the focus is on educators.
Oh, okay.
Yeah. And it's been expanded to also those, all the workers inside of the education system, not just the teachers.
Okay.
Yeah.
Okay. Is there like a specific number of days or weeks or months that they're advocating for in this bill?
No, I think that the standard is 6 weeks, 6 to 8 weeks. Yeah. That's the standard.
Yeah.
Across the board. What I do love about Birthmark and other reproductive justice organizations, we get to make those policies without the law. You can have paid family leave in your corporation, in your business, without relying on, the government telling you that you have to do it, which is really wild to me.
Yeah.
And I tell a lot of people, I'm like, to make the government do what they're supposed to do, like your state government is really, really crazy.
Yep.
Yeah. It feels hard. Yeah.
Yeah. I mean, I would say that that's a massive problem. When I had my first child, I was in residency, so I was working for like a state hospital, and I had to take. I mean, there was no such thing as maternity leave. That didn't exist, and so I had to take like all of my vacation and sick leave, and I got 4.5 weeks.
Wow.
Yeah,
you're not even, you still right.
Almost,
Yep.
yeah. I'm like,
Yep.
just from your body recovering, let
Totally
alone
unhealed.
trying to like get a newborn situated.
Oh, goodness.
Yeah. And it was, it wasn't like I got to ease back in. It was like I went right back to like 24-hour call, 36-hour call, with a newborn.
Oh, my goodness.
I know.
There are a couple of medical facilities here that, I mean, you would think that you would prioritize this, being that you are a hospital and a facility. But I've heard that they're like 3 weeks max.
Yep.
Like nurses are coming back to work.
It's terrible.
After, like, they take care of people, right?
Yeah. Yep.
And it's our job to take care of them.
Mm-hmm.
Wow.
I know.
That's really tough.
That makes my heart hurt because I'm also thinking of like I imagine when I come back to work sick, that first day back, and you're just like not quite at 100.
Not even close.
I can't imagine having a child and going back to full days.
Yeah. Yep.
And what
full days and caring for people.
And caring for people. Like your DNA completely changes.
Yeah.
You are a whole new person.
Yep.
So imagine 3 weeks. I just got this little person.
Yeah.
I don't know who this is. Right? I don't know who I am.
Right.
I don't know. Now I have to suddenly get back into the swing of going to work, making meals, doing your like daily duties. But also that really hinders our breastfeeding longevity.
Absolutely.
Which then gets me to, does your place provide a space for you to breastfeed properly? Or like to pump or to feed your baby because I know some families who are like, okay, my partner, if they have this, this is the creme de la creme. Your partner go pick up the baby, they bring them to you, you feed them, they take them back to the child care center. But how far is the child care center? And if people can't afford child care centers at this moment. So I think that it's just so many different levels of thought, that invisible thought, right? That you have to do as a parent.
All that planning. Yeah.
Yeah. So 3 weeks is not long enough.
No.
Invisible thought is really interesting. My friend had her first child, I think 2 years ago. He's about to be 2. And I remember talking to her over lunch and she was like, yeah, I'm going to save up this much PTO and then I get this much sick and then I get this. And I remember her going through how she was maximizing her leave. And I'm like, this is crazy. She works for a international company, the office here. And I'm like, this company is too big for you not to just say, I've got 4 weeks and then I'm going to use I feel like she should have just had 4 weeks of maternity leave.
Right.
And then just like out the gate and then
added the 4 weeks.
Added whatever additional time she wished.
Right. Yeah. It's super hard.
Yeah.
It's hard that our families are not have to do all of that to like prep. Now, and as you were talking, I was like, but that's if you have a perfect birth. That's if you go,
exactly.
That's if you are like, I'm going 38, 39 weeks. I'm going full term.
And a healthy baby.
And a healthy baby. That's luck, right. What if 28 weeks?
Right.
Some 32 weekers?
Right. Yeah.
And imagine 4 weeks after that, your baby's in the NICU.
Right.
So it's very, I need us to think. I always say like, they up there playing, checkers or chess or I don't know, jacks.
They playing
they rolling balls or trying to figure out, no, this family, mess them up. I don't know. But I think that families are suffering.
Yeah.
Like there's real lives on the line.
Yep.
That's why it's so important for us to vote.
Yeah.
So important for us to vote. It's so important for us to use our civic voice to, you can tell your legislator, I don't like this. This affects me. You can testify. This is your right.
Right. Yep.
This is your right.
Absolutely.
Yeah.
So you're trying to share this information with everyone. I know you're doing a Black Birth Matters Summit, correct? Can you tell us about that?
Yes. We are embarking on our 10th year of this summit. Not 10 years consecutive, but it started in 2016. With some brilliant souls who decided to bring together birth workers, health providers, or anybody who's curious about birth. I always say I love my green people. If you don't even know, if you have an inkling of like, what is maternal health? What does that mean? How does it affect me? Or how does it affect my neighbor? You should come through. But our goal is to build a solution together we're always talking about, the conversation is really rooted around innovation, and we've been able to take it beyond New Orleans into other parishes and areas like Baton Rouge and Lafayette, and we'll be in Shreveport in May. And in those areas, we showcase the work that's already been done. I always say it's not a birthmark show. This is about the innovators and community leaders that are in your area who are doing great things, and you should tap in. So this year, celebrating 10 years, we'll be in New Orleans. We're trying to do a big shebang. We want to do a film festival, book signing, a full day of summit conversation and talking. And in those summits, we always try to prioritize not just the Black birthing experience, but also rest. We want some form of massage or some form of sound bath to let our birth workers have a little bit of respite beyond this. This work is hard. It's hard for all of us because we want better, wonderful things for our families and for ourselves. Yeah. For ourselves as well. Yeah. Yeah.
Since we're on that topic, can you talk a little bit about Black maternal health and what's going on in our country right now, in our state?
Oh, Black birthing people are still 3 to 4 times more likely to have some type of pregnancy-related comorbidity or maternal mortality issue outside of birth. That's wild. Yeah. 3 to 4 times. Still in 2026. We're still dealing with that. So Black Maternal Health Week is rooted around just that, providing information, advocacy, a space for also our birth workers to have respite. And it's a movement across the states. Yeah. It started in Atlanta with Black Mamas Matter. And then it bloomed from there. So this week there are a lot of activities I know across the state where families are really, organizations are hosting events to provide awareness around Black maternal health.
I think speaking that stat as much as possible also starts that conversation, because it is crazy that in 2026 that stat is still so vast that across the board, across our country, that we still have that, I'm trying to think of the word I want to use, but lack of care that's being properly given to Black birthing people.
Right. And birth is natural. This is people have been birthing since Jesus. long before that. People have, since AD, BC. Birth is a natural occurrence in life. And so to treat it as an emergency and then, using medicine as a way to sometimes coerce parents into doing things that they don't even understand. Yeah. That's why we always say nobody should birth alone. You should always have someone, even if you can't have a doula, someone that is able to help and advocate for you. Imagine laying in the bed, 4 or 5 hours, sometimes dehydrated. Yeah. They won't let you eat. You can't get up, and then something happens in the midst of it and you don't have any, you no longer have any brain power to be like, hey, whoa, hold on. Yeah. Can you tell me what's going on? Yep. And they move so fast sometimes.
Right. And someone that you feel comfortable saying that, whoa, I want you to speak slowly to me and this person. Exactly. Say that one more time before we bring in this machine, do this thing, wheel them out, whatever. Explain what you're doing.
Yeah, and that's our biggest role as doulas, is not to, impede on the medical process. Our job is, we're hired by the client, we're not hired by the hospital. And so our job is to educate our families on every possible intervention, cause, effect, anything that happens in the birthing experience. And so we go through scenarios like that. If someone's coming in and you're feeling rushed, don't know what's happening, you can get up, and we can, go ahead, ask the question. Yeah. Say it. Yeah. 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 Our job is to empower our families to take that pause. This is your body.
So at what part in the pregnancy do you usually get involved as a doula?
It depends on when they show up, but usually around 28, 30 weeks. Yep.
Okay. And you're, like you said, you're walking them through every possible scenario that can happen in childbirth. Yep. And I guess helping them to like think through it and think through their plan.
Yes, you have to have a plan.
Because a lot of people don't, right?
You have to have a plan, yes. Because you just need to talk about it.
Yeah.
Let's talk about it. Let's
Yep.
put it on the table.
Yep.
A lot of people go into birth. Now, while birth is natural, the spaces where we give birth are not always natural.
Yeah.
Right? It's not the natural occurrence. You're not always in your home. People don't have, you may live with somebody else. You don't feel comfortable laboring in this space.
Right.
So like you have to make those contingency plans. And we also talk about the postpartum period. Well, who's coming after me?
Yeah.
Yeah, because typically our doulas do between 3 to 4 postpartum visits. So who's coming after me? Let's set that up.
Let's
go
have
that conversation.
Yeah. That's awesome. That's awesome that y'all provide that for parents, because unfortunately there's not really any other provider that does that, right? Like your standard OBGYN is not doing that.
Right.
Yeah. They're not thinking through not that that's their fault, but that's not their job. I guess they're not thinking through all those things that parents really need when they have a baby.
And they may be, but they may be doing it in a silo or doing it amongst their colleagues.
Right.
But our job is to have this conversation with our parents.
Yeah. That's amazing. Okay, so in the next 5 years, in your ideal world, what would you like to see change for maternal health in Louisiana?
5 years feels like so long, but also so close.
Yeah.
But in my dream is that we are top headlines. Louisiana is the safest place to give birth.
Yeah.
I love that.
Right? That we don't have that 2 to 3 more times more likely to die at childbirth. Like we don't have those stats anymore.
Yeah.
My dream is to be able to, parents are able to walk out of the hospital with a complete package, PT, OT. Imagine having a C-section and now for a knee surgery, you get PT and OT, right?
Yep.
But you just cut 7 layers of skin. Right. Wow. And I go home with nothing. Not even home health.
Yep. Yeah. Nothing.
Just some glue
right.
across my skin.
Oh, and you've got a new baby you've got to care for too.
Right.
Yeah, don't forget about the
Don't
baby.
forget the baby. Oh no, and my breast
your
hurt.
own health.
Right.
Yeah.
Right. And I get, and it's postpartum depression. Like I dream that we have like total care packages for our parents when they leave the hospital. That they're able to have lactation support covered. Postpartum support. Postpartum doula support covered, which they do, yes. I just want them to walk out feeling cared for in this healthcare system.
Yep.
Like adding the care for real.
Yeah.
Yeah.
And like prioritizing it is one of the most important life events that you can have.
Oh my gosh, yes, exactly.
So Victoria, how can people connect with Birthmark?
We're on all the socials, but also we have a website, birthmarkdoulas.com. You're able to, tap in, get our newsletters, see what we're doing. We're always hosting events or popping up in places. So Instagram is always, and Facebook is the best way to catch us.
Okay. Any other ways to support you guys?
Hey, I say this reproductive movement needs money. We can't do this without. And also because of the state of Louisiana and what we're dealing with in this reproductive time, this is not a one-time investment. We need 10 to 15 years of investment from folk, We need long-term investment so that our families can be safe beyond this current climate. It's tough.
Yep.
Thank you so much. This was a great conversation.
Thank you.
Thank you for having me.
Thanks for listening to Missions Bayou, powered by Comfy Stone. If you enjoyed this episode, be sure to follow the podcast wherever you listen. And if you're watching on YouTube, don't forget to subscribe and drop a comment, letting us know your thoughts and who you'd like to hear from next. We'll see y'all next time.